Hey y'all. Hey. I am LaShonda Hollins with Hollins S.P.E.A.K.S. And today is episode 1 of my Let's Talk About Sex series. So I am super excited because these are all topics that are so very important to women and women's health. And so I'm excited to be sharing. Tonight we're going to be talking about, I took notes, so if you see me looking to the left, I took notes because I want to also make sure that I am giving the most accurate information, and I also want to make sure that I'm giving you everything that you need in this video to better take care of yourself. So wanted to take notes, wanted to make sure I didn't miss anything. So here we go. I am going to wait a couple minutes and hopefully some people will jump on. I told you on my little promo ad to grab a glass of wine. So I do have my glass of wine. And I also have my water though. So so it's important to get your water into. I have not always been a water drinker. And so I'm trying to do better. Drink a gallon a day. It's not always a gallon. I usually try to at least get a half gallon in, and that's what that container is. So 2 of those is a gallon. But nonetheless, I want to jump right in. If you are just watching this and it is a replay, please put hashtag replay. I love replay hashtags and I love shares. So if you enjoyed this video, please share it as well, because again, it's very important information. So tonight we're going to be talking about pain during intercourse, and the more medical term for that is called dyspareunia. And dyspareunia is basically exactly what I just said. It's an experience of pain during intercourse. And I know when we hear pain during intercourse, we hear dyspareunia, we think, oh my God, that sounds like bad or disgusting or whatever, but it's not. There are several reasons that women can experience pain during intercourse. And so that's what we're going to talk about today. I'm going to tell you a little bit about my experience with dyspareunia. I am going to tell you what the signs and symptoms of dyspareunia are. And I'm also going to be giving you some remedies throughout and just telling you when you may need to seek need to see your medical provider for additional help. So that's what we'll be talking about tonight. So again, grab your glass of wine, sit down, and let's talk about dyspareunia or pain during intercourse. So again, there are several ways that you can experience dyspareunia or pain during intercourse. And you can experience it vaginally. So there can be this vaginal pain. You can have a pelvic pain, which is more of a, let me go back. So for vaginal pain, you can experience a burning sensation or a itching sensation, or it's very centralized to that area. And then you can experience pelvic pain. So pelvic pain is going to be cramping and aching and things like that in your pelvic and stomach area. And then of course there is vulvar pain, which is vulva pain. And if you are not as familiar with your body, then basically that vulva area is the external genitalia. And so that's where you're going to be experiencing the most of your pain. And so we'll get into the different types and just kind of go into what causes it and kind of give you what experiences you may be feeling throughout. But what I would first like to start with is telling you a little bit about my experience with pain during intercourse or with dyspareunia. So it was dyspareunia that actually led me to realizing all the other women's health issues that I had. It was actually dyspareunia or pain during intercourse that made me curl up into a fetal position in pain. And that is what led me to my doctor's office. And from there is where I found out that I had cysts, ovarian cysts. I had fibroids, and I also had polycystic ovarian syndrome. And so that's why this topic is so very important to me, because this is what helped me get to where I am now. And again, if it wasn't for my experiences, if it wasn't for me having this pain, this sensation, then I would not have got the help that I need in order to be here talking to you today and telling you about the importance of women's health. So sit down and let's go. So first I want to tell you a little bit more about the types of pain. So I just told you there are several ways that you can experience pain, which was the pelvic pain and the cramps and things like that. I actually experienced excruciating cramps. So my pain was a deep pain. So it was like an aching pain, a cramping pain, and it's not your normal menstrual cramps. It is a excruciating pain that makes you you basically know something is wrong with the type of pain that I had. And of course, everybody's pain is not going to be that way. So listen to your body and just know that when your body is doing something different, it's not okay. Like you should be getting checked out. So you can experience deep pains, you can experience sharp pains, and you can experience burning sensations as well. So these are the different types of sensations that you may experience when you're experiencing pain. So it's not just going to be oh my goodness, that hurts my pelvic area. It can be several different sensations and experiences. So the most common cause of dyspareunia is going to be insufficient lubrication. So, of course, this is not something that you would have to go and see a provider for immediately. There are several home remedies that you can do. You can relax. That is usually one way that you can do it. So you can relax, you can use water-based lubricants, and you can increase foreplay. And sometimes people are just jumping in prematurely, and so that can cause dyspareunia and make you think that something is wrong. So very, very common. It is the most common reason for dyspareunia. Other reasons that you may experience dyspareunia: urinary tract infections. This is not one that can be treated at home. This is one that you will need to see your medical provider for, because you will need to treat the urinary tract infection. Different skin conditions. A lot of people have severe skin conditions that travel all over their body. And so this is another reason that you may have to see a medical provider, because you're not actually treating the dyspareunia. It's what's causing the dyspareunia in this case, which is going to be your skin condition. Vaginismus. Vaginismus is another type of pain during intercourse, or another reason for pain during intercourse. And basically, this is some of the ones at the beginning are not those that you will need to immediately go see your OBGYN for. These are some that, like I said, you can kind of treat at home with remedies, or these are something that you could probably go and see your PCP about and just tell them, hey, I'm experiencing this and it's due to my skin condition, or whatever the case may be. Now, vaginismus is basically an involuntary spasm in your vaginal muscle. And basically what that is what it's due to is fear of being hurt. So if you have been hurt before during sexual intercourse, I like to think that it is kind of a mental thing, because you are a little bit more tense, you're a little bit more worried about things, and so vaginismus is gonna you're tense and you're tightening your body, and so you're having those spasms in your vaginal muscle, and that's vaginismus. Another common cause of dyspareunia is yeast infections. Yeast infections are so common with women. And so we have to treat the yeast infection in order to treat the dyspareunia. I know that I really want people to understand that we're talking about these things because they're important. Women should not be ashamed to talk about what goes on with our bodies, because if we're not talking about it, if we are not sharing and talking to our doctors, then we're not getting treated and we're not getting the help that we need. So it's very important. I know that talking about these things feels taboo, but it's what I'm doing. It's what Hollins S.P.E.A.K.S is all about. And statistics actually show that a lot of women suffer from dyspareunia. A lot of women suffer from sexual intercourse. There's been a study on this, and it shows that several women experience dyspareunia, but less women actually talk to their providers about it, and less doctors actually ask their patients about it. So again, we have these issues. So we marked, yes, I experienced this. Yes, I have this. Yes, this happens to me. But when we go to the doctor, we're not saying, hey, this is a sensation I'm experiencing, or this is something that's bothering me. And so we're not getting treated, and we're missing all of these things. So, I just briefly told you about yeast infections. There's not a lot that I can tell you about yeast infections. I think we're very familiar with that. If you are working out and sweating a lot, if you are wearing tight clothes, anything that is causing a yeast buildup in your body can cause a yeast infection. And so if you are engaging in any kind of intercourse, any kind of sexual intercourse, when you have a yeast infection, it can cause dyspareunia or pain during intercourse. If you're just joining the conversation, dyspareunia is the more medical term for pain during intercourse, which is what we're talking about tonight. So now we're going to get into a few of the more serious causes for dyspareunia. Cervix issues. So basically, cervix issues, what that relates to is more pain during deep penetration. So again, that one's not very serious, but there is a pain when there is a deeper penetration. Endometriosis. Endometriosis is basically when the tissue that lines, that's similar to the tissue that lines the uterus, is actually growing on the outside of the uterus. And I don't know if you're familiar with endometriosis, but it is definitely one of the things that we had to rule out for me just in 2019. In February of last year, I actually had a surgery. I don't know if I share that with a lot of people, but I did have a surgery in February of last year where I had it was basically called a laparoscopy. And they were going in to kind of see what was going on with my tubes, what was going on with these blockages that I had there in my uterine area. So, and one of the things that we ruled out is endometriosis. So endometriosis can cause a lot of pain. Definitely pain during intercourse, excruciating menstrual cramps. It can also prevent pregnancies, make it harder for women to conceive. So endometriosis is one that's a little more serious, and it's something that you would definitely talk to your OBGYN about, so that they can kind of address the endometriosis with you. And again, you won't know that you have these things unless you're talking to somebody about these sensations that you're having. One of the other issues, ovary problems. This can be ovarian cysts. That is exactly what I had. I had ovarian cysts, which is part of polycystic ovarian syndrome. Sometimes the cysts rupture. It's very, very painful. That is actually what happened to me, which is when I talked earlier about, kind of curling up into a fetal position due to excruciating pain. I actually had a cyst rupture. And the thing with cysts on your ovaries is that they pop up so often, and some of them rupture and there is no pain, and then some of them rupture and then there's excruciating pain, like I experienced. And again, that's what led me down this women's health road. That's what actually sent me to the hospital, that led me to my other women's health issues. So ovary problems are very important, something that you definitely want to talk to your provider about. Make sure that you get checked. Any of these symptoms that you're having and you don't know what's causing it, you definitely want to have yourself checked. So pelvic inflammatory disease. Pelvic inflammatory disease is basically when the tissue inside becomes inflamed and it causes a deep pain in your pelvic area. So basically that's exactly what it is, just inflamed deep tissue. Ectopic pregnancy. Ectopic pregnancies definitely can cause dyspareunia. But the other thing about ectopical pregnancies is that they can be very, very dangerous. An ectopical pregnancy is when the fertilized egg that usually develops inside of the uterus is developing outside of the uterus. And ectopical pregnancies, if they are not caught in a timely manner, not to scare anybody, but it can cause extreme issues. It can lead to death as well. So again, make sure you're getting checked. These are things that we don't want to miss. Menopause is another reason for dyspareunia. Menopause, of course, is I don't want to say it's just due to aging, but basically once you hit a menopausal state, you lose moisture in your vaginal wall, and you experience more dryness. So menopause is coming. And that is one that you will want to talk to your provider about if you're in menopause and you're experiencing this, because when you reach that level, there are additional medicinal things out there that you can use that can aid in that, because it's not always as easy as just using a water-based lubricant. Now, this is the one that everybody usually goes to all the time when you start talking about pain during intercourse. And I really just went over 10 with you before we even got to this point. But STDs are something that can cause dyspareunia. So sexually transmitted diseases that involve warts, sexually transmitted diseases that involve sores, herpes, things like that can cause dyspareunia as well. And this is definitely something that you want to talk to your provider about, talk to your doctor about, because again, you're going to have to treat the STD in order to have some relief from the dyspareunia. Again, vaginal or vulva injury. Basically what that means is, this is for my mamas out there. I told you earlier that the vulva area, if you're not familiar with your body, is the external part of your genitalia. So for my mamas out there, vulva injury or vaginal injury is basically from childbirth. So there's a cut between the vagina and the anus when you have during labor. Or there is a tear during labor. And this definitely causes pain during intercourse. And so one of the remedies for that is just going ahead and waiting that 6 weeks before you have sex again. That's the best remedy for that one. And then this last one, bear with me, I could not find a pronunciation for this. I think it's called vulvodynia. Basically, vulvodynia, which is our last one, it is a chronic pain or discomfort in the opening of your vagina or your vulva area. Again, that external area of your genitalia. And so it's called this instead of dyspareunia because this is one that doctors don't have a cause for. They don't know what causes it, and therefore there is no cure for it. And so they do have remedies for it that can help you, but it's more chronic. So all of the ones that we talked about earlier, they are treatable. There are ways that you can talk to your provider to make sure that you're having a more pleasant sensation during sexual intercourse. But with vulvodynia, these people are having chronic pain during intercourse or chronic dyspareunia, and they can't get rid of it. It won't go away. And so it's a diagnosis all of its own. And again, doctors don't know what causes it, but it is definitely something that you would be talking to your doctor about if it's ongoing and nothing is working for you. So just to recap, I really want to recap the remedies that we've talked about. So again, mamas, wait 6 weeks for sex after labor. Or childbearing, because there are vaginal tears, there are things that can cause dyspareunia that causes that pain during intercourse. And so if you rush back into it, your body has not properly healed. Very important. Also, medical care. So anytime, as we discussed during menopause, or there is no real reason as to why you are experiencing dyspareunia, you can talk to your doctor. There are medications like estrogen creams and things like that you can receive that can provide some comfort during sexual intercourse. We also talked about water-based lubricants for those individuals who are kind of rushing into things and you're just experiencing lack of lubrication. You're just feeling a little bit more dry. And sex therapy. That's one that I did not mention earlier because I did want to wait to the end to talk about it because it's a little bit more of my area and my expertise. Basically, if you have, if the doctor is not saying that you have chronic dyspareunia, they're not saying that you have an STD, you don't have a yeast infection, you don't have any of these things that we just talked about, it could be something that requires a form of sex therapy in which you're dealing with something that's more mental health. There are a lot of reasons for this. People experience guilt. People experience inner conflicts with their own sexual preference or with their own sexual experiences. And so there's this tug of war battle, or people have experienced sexual abuse. And this causes more mental health related issues that leads to dyspareunia, that leads to dryness, because there's just really no, there's really no sex drive. Because of these things. And for women, if there's no sex drive, there's usually no lubrication. And so sex therapy is something, again, that may sound very, very taboo. When we're talking about pain during intercourse, when we're talking about sex therapy, people are, people may shun away, or they, again, may say it's inappropriate to be talking about, but it's very appropriate. It's nothing to be ashamed of. It is our bodies. It's women's bodies. It's natural. We have these issues and we have to talk about them and we have to address them. Again, nobody ever told me about any of these issues that women can experience. I, again, found out about it through pain, through dyspareunia. Dyspareunia, again, is the number one reason that I am a motivational speaker today. The number one reason that I am here doing this video with you. It is also the number one reason that I am drinking more water and trying to eat better and doing yoga and eating healthy. If it was not for this, I would not be here. So again, women, take care of yourselves. Listen to your body. Do not be afraid to talk to your doctor. Do not be afraid to talk to your friend and say, hey, Angela, do you experience this? Because 9 times out of 10, they have. Me and my friend Angela have had several conversations just about women's health issues, and we relate a lot. And we probably would never have had those conversations if we never asked each other, if we never opened up to each other about those things. So if there's someone in your life that will listen, ask them, talk to them. You guys can experience and go through it together. That's really what this is all about. That's what Hollins Speaks is all about, is just getting the word out there and making sure that that you are taking care of yourself, basically. I'm thinking if there's anything else. If y'all have any questions, you can definitely chime in the bottom. I will say that you are learning with me. I go through some of this stuff. I do my research on all of this stuff again, that's why I take notes, because it's important to make sure that I'm also putting the right information out there. So you're learning with me. As I learn, I am teaching you, and we are going through this together. So if you have your glass of wine, thank you so much for watching. Thank you for chiming in and just being an active listener. And if you guys have any questions, definitely chime in. #replay if you're just watching this, and share. Thanks again, y'all. Y'all have a good night. And I have on my Lime Life by Alcone gloss. It's called Love. And I also have on my Just Strong workout pants, which are super comfy and super awesome. If you're interested, I do have a discount code for those. If you're interested in Lime Life by Alcone, reach out to my best friend, Angela Robertson. She is also on here watching as Life with A. Robertson. I say Robertson, but Robertson. So definitely reach out to her. Nick, can we ask anything? Yes, you can ask anything that's appropriate, because I know you. All right, guys, please share and #replay. Oh, you want to see the pants? I don't know if I'm going to be tall enough. Hold on. Hold on. They have Just Strong going down. Can you see that? I don't know if you can see it. I think I just showed y'all all my hips and stuff. I just showed all my hips and still didn't show. I'll just post a picture. How about that? I'll post a picture and show y'all the pants. All right, y'all. Good night. Talk to y'all later.